Joined over the phone line now on the broadcast by Ms. Anumita Roy Chaudhary, Executive Director of the Centre for Science and Environment. Mr. Roy Chaudhary, thank you so much for speaking to us here on Mirror Now. We can see a very drastic, very strong advisory which has been put out by the Pollution Control Board now. Have you, in your experience, many years of experience rather, having dealt with the matter in Delhi, seen this as one of the worst scenarios that Delhi has seen, where the Pollution Control Board is now actually telling people not to step out if possible?
So this is season's first smog, and whatever data and evidence that we are seeing now since Diwali, this is likely to be one of the longest smog episodes of the recent times. And that is really worrying, and it is really a health emergency. And that's why what we really need to understand that what kind of action that we really need on ground, because this is a complex problem where you have the winter conditions setting in with cool and calm weather, and there is no wind in the city to blow away the pollution. And while local pollution is already very high, you also have pollution coming in from the NCR districts and also the stubble burning. And that is the deadly combination right now. But our analysis also shows that while, yes, there is problem of pollution coming from outside, but we also have to handle Delhi's own pollution sources. And the very recent data that has come out from the Indian Institute of Tropical Meteorology, who give out the on a continuous basis how much different pollution sources are contributing to the pollution in Delhi, it shows that currently at this moment since October, the vehicles are the biggest contributor at 50%, followed by the household stoves that people use to burn the solid fuel, then industry, construction, and waste burning. Now, that is Delhi's own problem. And we have to really scale up and speed up action across all these sectors to be able to control this kind of smog. In fact, you cannot handle winter smog only with enforcement measures and temporary measures during winter. You need round-the-year action to build the right infrastructure, systems in all these sectors. How can you control vehicular pollution, which is at 50% right now, if you have not invested adequately in public transport, walking, cycling infrastructure? And therefore, today, imagine in this city, the vehicle population is exploding at 1.3 crore. With so many, just understand that this kind of smog episode that builds up every winter because of adverse weather conditions can be addressed not with temporary action. That temporary action and the kind of what CPCB has alerted today, this is only what you can do immediately to just protect yourself. But you need so much more.
Ma'am, one last question before I let you go. Are you happy with the way the Delhi government or the agencies have been handling the situation so far? Do you envision a situation where they're going to bring back odd even very soon? Or is that something which even works?
They certainly need immediately, for the immediate response to this health emergency, they certainly have to say that what kind of emergency measures they are going to take to reduce toxic exposure for the population. Because emergency measures do not fix the problem, but they only help you to not to add more fuel when the fire is raging. And therefore, we need to know what are they going to do in the vehicle sector, the transport sector, whether that is odd and even or working from home or any other measure. Or also, and the other sectors in the industrial pollution, on waste burning. So you really need a very proper comprehensive measure to be able to address this kind of emergency.
Right. Anumita Roy Chaudhary, the Executive Director of CSE. Thank you so much for joining us on this. I'm also joined on the broadcast by Dr. Sanjay Bagai, Chairman of Nephron Clinic. Dr. Bagai, let's get straight into what people would want to know the most. How can we protect ourselves in this situation where top agency, top pollution body of the country is saying don't step out if possible because this thick blanket of smog in Delhi is probably going to stay for some more time? What can people do?
Good morning. I think this is very clearly a capital medical emergency. This acutely is going to cause immense amount of mounting and surmounting respiratory problems. Respiratory distress, especially in smaller children who are extremely vulnerable because of limited lung capacity, and the elderlies and people with comorbidities, known asthmatic. So I think the way forward is unless until it's extremely important, you should not step out. Please wear a mask and an adequate mask, preferably an N95 mask. Try to keep away from the smog early morning and late evenings. Keep the children and the elderly who are a known visa or have past history of allergies and asthma, please consult your doctor and take the prophylactic inhaler. But I think this is, a helpless citizen lot who's been caught because of just lack of. We know this, we debate this every year, year after year for at least a couple of decades. And this is an ongoing problem. It's not a novel thing which has happened for the first time. The smog tars internationally have shown very limited efficacy in a very small transient area. So we need more amount of public proper infrastructure for the road laying, for the road cleaning, reforms in the construction site, and to keep the unnecessary cars off the road. We need more digital mapping of the control of traffic. This is there internationally. It's not something which I'm speaking as a novel thought. This is happening all over the world in major metros. So I think we need to control vehicular, industrial, road, and construction dust pollution, which will have an immediate impact. And the government agencies need to speak to the neighboring states. This is without bias, without any political affiliation. I'm only speaking medically, and without fear and without favor. I think all the governments need to sit down together. One person, two people, 100 people, 1,000 people burning crops in the neighboring states is going to have a devastating effect. My fear is that in the next 10 years, we are going to see a huge upsurge of cancers in all age groups, which is unfair, and it is totally uncalled for and preventable. And this is going to harm the pregnancies and the young fetus, which is still to be born. This is not fair for our next generation. I think we all need to be responsible, including the citizens. We need to have more smart ideas of carpooling. We need to have more rational use of public transport. And of course, we need investment in public transport. If there is a world-class infrastructure, you will see most of the cars not being used as private cars. Over to you.
Your words of advice and also a comprehensive understanding of how the government is failing year by year to actually improve the ground situation, and people are left suffering. Time for us now to slip into a short break, but more news and updates on the other side.